Hello, everyone, and welcome. My name is Zoe, and this is my mum, Marilla, and we are super excited today to be talking to everyone about our presentation, The Invisible Years. Is there a right age to be a therapist? First, a little bit of context about the two of us. I am a registered mental health social worker, originally from Melbourne, but I'm joining you today from Mauritius, where I've lived for the last 2 years. I've spent 5 years living in Southeast Asia, largely divided between Thailand, where I was working as a trauma therapist, and Cambodia, which was the host country and backdrop to my doctoral research in the area of trauma and resilience. Over this time, my mother and I worked on a joint project in Myanmar together, and I'm really excited to collaborate once again to bring you this presentation. And Marilla, I'll let you introduce yourself.
Thank you, Zoe. I'm speaking from sunny Docklands in Melbourne. So we're miles apart, but it's great to have the opportunity to work with you again, Zoe, even though we're across huge oceans. My background, predominantly I started out as a TAFE teacher in the area of early childhood. I did 20 years in TAFE as a head of department and taught in the areas of early childhood, youth work, welfare and aged care. And at the age of 57, I decided to become a psychologist. So I became registered as a psychologist at 57, and most of my work has been in the employee assistance space. I do a lot of facilitation and supervision and coaching and some critical incident response. Thank you, Zoe.
So looking towards what we're going to be discussing in this session, it is very much around the intersection of age and people's perception of aging. And so we'll be taking a look at this twofold, from our own perspective, from our potential clients' perspective. I will be weaving in some examples, as will Marilla, about our clinical experience and what that's been like. Certainly focusing on the visibility and the invisibility that we might experience at different stages in our career. Marilla?
Just a bit about demographics of psychologists. The Department of Health in 2017 looked at a bit at the psychologists, and female psychologists comprised nearly 80% of the workforce, which is an increase since 2014. Also, I think it's interesting that the average age of the workforce was 46 or just over 46, and that was an increase again since 2014. And also the proportion of psychologists aged 65 and over increased from 7.6% in 2014 to 9.6% in 2017, which is actually quite interesting. So not only has there been an increase in the older therapists, but there's also a greater number of female therapists. So my question is the question of invisibility more relevant for female psychologists or social workers for that matter? Zoe, what do you think?
One of the most dynamic clinical teams that I've worked with was in Thailand. I was in part of an inpatient treatment setting where our clients came from all over the world, and that was reflected in the clinical team. As to ages, our youngest therapist was 28, the oldest was 74. And what we found is that some of our older clients didn't necessarily want to work with younger women. That didn't seem to be a clinical match. But I think the intersection as well in terms of how we feel about aging comes up in the demographic data as to our interactions and relationships with clients.
Maybe we should just focus a little bit on definitions. Invisibility, that's it's being impossible to see, not being noticed, being ignored, or not taken into consideration. Ageism is a belief or a tendency to have negative feelings towards someone based on their age. And here I am actually talking about being older and being younger, because ageism is not just something that older people experience, younger people can also experience ageism, and we'll look at that a bit more later. And also a definition around age-related social stigma. It does have effects on our physical health and psychological well-being and our self-perception, how we see ourselves. And if I can give an example, as I've got older, I suppose there's a bit of an understanding that as you get older, you tend to forget things. And so I'm always saying, oh, I'm just having a senior moment. So clearly I'm already identifying with something that is probably, not so good to be reminding people that I forget things all the time. So that there is some social stigma that we've learnt about age. Next slide, maybe. So it does, I do want to sort of just follow up a little bit with some myths and misconceptions about aging. Some of the research that is around indicates that views on aging are becoming more negative. Certainly in terms of as we get older, our cognitive abilities are less, clearly we forget things, and physical capacity as well reduces down. So negative stereotypes about aging develop in the same way that we might have stereotypes around racism and sexism. Ageist sort of beliefs occur when we're young. What do our children see and hear about older people? If what they see and hear are remarks about capability or lack of capability, they will grow up worrying about getting older and not feeling good about it. If in fact children experience positive comments around aging and wisdom and experience, then as you get older, our perceptions of ourselves is much more positive. Any thoughts on that, Zoe?
To sort of further add to that, what I've seen as well in my length of my career, my early career was in hospitality management. I didn't start studying social work until I was in my early 30s. And being a very young manager in a male-dominated industry, I found that I felt like I had to fight to be heard, to be taken seriously. Now in my profession currently, I work with a lot of corporate Fortune 500 companies in the area of mental health and well-being. And the combination of being a bit older and also having a doctorate, I've seen the way that people introduce me for sessions with a level of credibility that seems to be automatically given, not necessarily based on my experience, but just the combination of a PhD and being a little bit older. People immediately have this assumption that if I open my mouth, I'm going to know what I'm talking about. Hopefully that is the case, but it does appear to be a lot more automatic. And so stereotyping as well, I feel like all of us have experienced at some stage, whether that's in our personal life or professional life. It can be age-related, it could be gender, socioeconomic background, ethnic and cultural backgrounds as well. Some of us have experienced a lot more stereotyping through the intersection of these factors as well.
Sorry, could we go back to that previous slide?
Yes, absolutely. Too far.
Yeah. Just a couple of points I want to make. I thought it was interesting, a piece of research which was done by Cuddy et al. In 2005. I thought it was really interesting. They found that people had a perception that older adults were warm but not competent. So I think that's interesting. So we're obviously really nice and supposedly maybe empathetic, but we're not competent. We asked, I'm saying we because I'm in that age group, we might be seen as having a lower level of ability and maybe less motivated and lower productivity. I'm not totally sure that the research says that is where people hold that thought. And I really like the last one, older workers were unable to learn and not adapt to change. And I find myself as I've got older thinking, oh, it's a great idea, but we've done it to death and we know that it hasn't worked. Whereas a younger person might go, oh, they're just so resistant to change. Now, where do you go with that? One group will think, this is really great. I've thought about it. I want everyone to try it. and other people going, we've done it and we know it doesn't work, but it comes across as resistant to change.
I think that's a fabulous point. I was reading some research about the stereotypes essentially for different age groups. And although I'm not a boomer, I'm Generation X, and the same stereotype has been leveled at Gen X that we are resistant to change. Now, I've lived in 6 different countries, so I actually feel like that's a very good argument to say I'm rather adaptable and quite enjoy new challenges, new environments, and new experiences. And it raises some serious issues, I think, when people are having or creating these biases around ages and that we are defined and labelled by our age. So woven into this presentation, we have several quotes as some examples. And this one really talks about lived experiences and the life experiences. Older clinicians might be dismissed as not keeping up with new developments, but then other times what we see is that younger clinicians are dismissed as a result of not having enough lived experiences. So it's twofold. Marilla, would you like to add anything to this?
No, I think you pointed that out. I think that the dichotomy of people's perceptions and not really getting to understand us as individuals and versus therapists. And we'll talk more about therapists. Actually, this is more important. Let's talk about the younger workers and what they might be feeling.
When I was in this incredible clinical team in Thailand, one of the therapists was in her early 30s, but looked about 26, 27. And as a result, her clinical caseload was often the very young clients we would see as a result of what she looked like, even though she was one of the most qualified on the team and had started in psychology at a very young age. Sometimes with the older clinicians themselves, they would overlook some of her thought processes around her practice, as well as some of her clients saying, I would like, or requesting an older therapist for more experience. And certainly when we look at the research around different generations, we do see that Gen Y and the millennials to a lesser degree are often labelled as being sensitive. I was running a session recently with a group of senior leadership across Europe, and some of the questions they had to me was, do you have any specific strategies for Gen Y because they seem to be rather sensitive? Followed up by another leader saying, I agree, I feel like the younger generation are far less resilient. And these are stereotypes that very much exist. So how does that then interplay as a therapist? Marilla, any further comments?
No, I think that's a really good comment and leads quite well into the next slide, which is a comment around how people perceive therapists of different ages.
So this one talks about bringing people up to speed. When I was doing some of the research and quotes and things that I could add in, there was another great comment that talked about, I'm not sure if an older therapist would understand online dating and what that means. And so sometimes when people seek out a therapist, it is about, is this person going to understand me? And as therapists, we know that that relationship and the ability to build rapport and trust with a client is critical to any kind of long-term benefits of seeing a therapist in the first place. So if that judgment, bias and stereotyping is happening automatically before the therapist has even said 5 words, it can lead to conflict and friction in the therapeutic relationship.
Yes, and I would like to add to that, Zoe. When I read about the person thinking they've wasted time talking about organic foods, my mind goes to, well, was the therapist actually trying to build a relationship, or was it an intake session? I want to get to know the person a bit more. And so that what appears to be chit chat is actually not a waste of time. It's part of the therapeutic intervention, but it's perceived as, oh, younger ones just talking about organic food.
And bias occurs at all ages. It depends on that interaction throughout our lives, whether it is with other clinicians, whether it is with our clients. Most people have experienced some kind of ageism at work. There is, of course, a lot of laws and legislation and protective measures for this to not be a case, but what people think and maybe what they say might not necessarily be one of the same. And if 56% of people over 50 have experienced some level of ageism in the workplace, that is a significant number. And that's certainly captured in some of my lived experiences working with groups right across the world. One of the sessions that I've been running that speaks to this is menopause and mental health. And women globally have shared their experiences of how they feel more and more invisible as they get older. There was a very big UK study that suggested 1 in 10 women exit the workplace due to menopause symptoms. And a lot of that speaks to perception, and also the physical symptoms layered with how people are treating women in the workplace. So ageism might be there for the young ones being labelled as inexperienced, and older as in you have less to contribute.
Thank you. And I'd like to add to that. We've talked about biases that people might have, but I'd like us to also think about, do we have some biases? Now, biases are not always a negative, but they're there. And maybe I'd like to perhaps put a scenario to you. You can see us, and so you know what we look like, but we don't know what you look like. So I've made some assumptions already. So because I can't see who you are, I'm making some assumptions which might suggest some of my biases. I'm going to suggest that people coming to this conference are possibly a younger cohort of psychologists. You're possibly working with children and adolescents predominantly, and you're probably having to communicate with parents who may be at least 5 or 10 years older than you, and who might make judgments about your capabilities, especially if in fact you have not yet had children. So there are some thoughts I've got. Now, they can easily go into biases a little bit, can't they? The people that come to this conference must be of this cohort. So what biases do we have? You know, are we aware of that? We know all about unconscious biases, such as one of those fabulous terms that we now talk about, but we might have some biases. Zoe, do you have some biases about psychologists?
Yes, and my mother and I always like to joke about social work versus psychologists and what kind of biases we level at each other's field. I feel like that might be another topic though.
Okay.
But it's true, we all do have some kind of bias. And I think one of our biggest interventions, so to speak, is to look at what are our unconscious bias, or even sometimes our conscious bias. We're very aware of the thought processes that we might have. And I'm going to talk a little bit about how culture interplays with this in just a moment, but it's important for us to be considering, what do we think about aging? When is the right time for us to be a therapist? What have we experienced in terms of stereotyping and bias that might have shaped our own views? Looking at some of the ways that we can intervene is acknowledge and accept the existence of bias. It is absolutely prevalent with all humans. And I've found that a lot of the research, and certainly some of the sessions that I've delivered over the last decade, when I first started talking about bias, a lot of statements were made around how we need to be free from bias. And as I'm talking to psychologists, we're sort of aware that that's almost impossible for the vast majority of humans to be completely free of any kind of bias. Neuroscientists talk about our templates for understanding the world, and what we can be aware of, instead of trying to aim for not having biases, is to acknowledge and then really look at, well, how is that presenting with me? Does that interfere with the work, or does that interfere in my personal relationships? And that's part of the self-reflection tool. I've always worked with a clinical supervisor, and I take a lot of everything into that relationship that I have to really explore what are some of my biases and how does that emerge in a clinical setting. We can encourage our clients to ask questions. And I know that a lot of you will have different thought processes around sharing anything of a personal nature in a therapeutic setting. I have worked with therapists who have been very open, who have disclosed if they feel that it is helpful for a client, and then others where that is an absolute hard boundary. And I am somewhere in the middle of that. And I feel that sometimes clients like to ask about my life. I don't give an entire personal in-depth history, but when I start working with someone, I give them a little snapshot and I say at the end of a session, if there's something that you are desperate to ask me, you please feel that you can. And I find that the clients that I've worked with are very appropriate. They've asked questions about my research. They've told me that they've Googled me, little things like that. And I think it helps to build a relationship. But we can also then encourage that in order to find richer insights, in order to check and look for bias in the therapeutic relationship. Marilla, would you like to add something?
Yeah, I've got, in terms of, us and who we are, I guess the bias comes into, if we assume the older we are, the more experienced we've got and the more knowledgeable we are, that might actually not be correct. Given that I became a psychologist at 57, I'm probably less experienced than a 30-something who's done masters as well as their undergraduate, and they've been working for 20 years. And they might be, well, yeah, I can't count clearly. If they became a registered psychologist in their 30s, by the time they get to 57, they're far more experienced than someone like myself, same age, but just coming into the industry.
There is a lot of content on this slide. I went down quite the rabbit hole of research. One of the areas that I've found fascinating is culture. As I mentioned, I've lived in a lot of different countries, and 5 years in Southeast Asia. There is a large amount of research on East and West differences in terms of perception of aging. And when I've started to ask questions, some of the responses that I've had from people in Asia, we respect our elders, old means wise. And we see some beautiful research coming from Japan, for example, that talks to that, and that people who are older still have a very big part to play in the shaping of society and also in the family. But there have been other research pieces that say it's not quite as different, particularly when it comes to women and physical attractiveness. We are still seeing that women in Asian countries are commenting and experiencing also stereotypes of what it means to be older. But I'd like you to think about how that then interplays with therapy and what we do. Do you see yourself as wise? Do you feel like people respect you either based on your clinical career, your qualifications, your age? Do you feel like you have those experiences to share with your clients? Because this is how we can start to push back on invisibility. When I first arrived in Thailand, I had just finished my social work qualification, and I was very inexperienced when it came to trauma. And I was very lucky to be working with the team that I got a huge volume of support. They knew that I was new, but my confidence has been built over those years since 2016 in terms of what I can do. And it's made me a lot more comfortable in who I am today because of my experience, rather than, well, now I'm in my 40s and people take me seriously. And I think this is how we begin to push back on that narrative. What is our knowledge? What is our wisdom? What do we bring to the table? So Marilla, what is the right age to be a therapist?
Well, I think it's now. What do you think, Zoe?
I think it's now too.
So you don't have to wait until you're in your 70s.
It was interesting because when Marilla and I first started talking about this session, and I asked her, when was the best time for you in terms of your therapy and clinical practice? And she said now. And I said the exact same thing. It is now. And I feel like we can be this at any age. For example, one of my close friends, she is a school counselor in Cambodia. She's American and she's 28. So she's quite young to be in a role where she doesn't have a huge volume of support in the school. But she's dealing with some really complex cases. She's working with children that have trauma and suicidal thoughts and things that were not covered in her qualification, American qualification. She's an undergrad in psych. And she draws from the skills and experiences of other therapists. She has clinical supervision, but one of the things I love about her is her passion, enthusiasm, and motivation. Her eyes light up when she talks about her kids. And she's also very funky looking. She's got half of her head shaved and the other long hair. She wears really cool clothing. And she works with young teens. And her right age to be a therapist, although acknowledging she doesn't have that wealth of experience and she's still learning, her right age is right now.
And for the age group as well. So if there is a potential to match the age of the client with the counsellor, it's not bad. But that's not always going to be the case. So we're obviously not going to go, oh, sorry, you're a bit too young for me. I'm not going to talk to you. But it is something that it is a factor that can work really well, but it's not the main thing.
And so as we move into some suggestions for what do we do about this, if we are working with clients with bias and stereotyping and we're feeling that that's the case, have a think about what are all of your strengths? What do you bring to the table when you work with clients? And how do you then communicate that to them? So the focus is less on how many years I've been on the planet and more, this is what I bring to the table. Are you able to develop a snapshot or a little spiel that you talk to your clients about at the start, where you do give them a little information that you're comfortable in sharing that speak to your talents, that speak to your strengths? And this helps as well really design your path through this. It is an exploration of strength at any age. So just in conclusion and our sort of action takeaway points from today, consider what your skills, strengths, and wisdoms that you share with clients. How do you capitalize on that in terms of promoting yourself? Many of you might have a website. Many of you might interact on social media. Someone suggested to me the other day that I needed to be on TikTok, and I just went, hard pass. And then this time, every bit of my Generation X, I'm not going to promote myself on TikTok, I just know. But I've been shown these videos of therapists that are older than me that are on TikTok talking about psychological theories in 2-minute snapshots for the masses. And I think this is really interesting because it doesn't matter about your age. It's more about what you're comfortable with. And also, how do we then reframe aging? How do we become visible based on our lived experiences rather than years on the planet? Marilla, would you like to add to that?
No, I think that's a really good conclusion point. I think for me, it is about, are we in an industry where we potentially put other people's needs in front of our own? Because we are in the profession to support others, regardless of whether they're children, adolescents, or people in the workplace. And I really would like people to think about, how well do I promote myself? Do I just get on with the job and do it quietly? Well, no, maybe we could take a little bit of time and go, I need to let people know, as you say, Zoe, what are my strengths, what are my capabilities, and what I bring to the therapeutic relationship.
So Marilla, will you be getting on TikTok after this?
No, because I'll probably have a senior moment and forget.
All right. So speaking of shameless self-promotion, here we have website, Facebook, and we are both on LinkedIn. So we would actually really like to hear from some of you. If you want to reach out, contact us, share your lived experiences of visibility or invisibility, we'd love to hear from you.
That would be great. Thank you so much for spending time with us.
Yes. Thank you everyone for listening, and I hope you all got something useful out of this session.